I am a product of rural Arkansas. I grew up in rural Arkansas. I trained fully in medical school and residency, all in Arkansas. Giving back to the rural community that helped me become who I am is what drew me to working in this area.
What I love most is getting to help the underserved population. So we get to take care of all kinds of different patients, and I really enjoy getting to go back to my community that I was born and raised in and get to see familiar faces and help them reach their healthcare goals.
I didn't know if I would come back close to my hometown or not. You know, it just kind of, after we started having children and our parents, my wife and I's parents lived pretty close by. It just kind of fell into place. So, but it's been good for us.
There was a gentleman who hadn't really seen a doctor for several years, and he finally decided to come in, and he saw me. He started complaining of chest pain. He really wasn't going to tell me about it, but we got just to chit-chatting, and sure enough, I convinced him to let me do an EKG, and there were some abnormalities. So I convinced him, like, hey, we need to go to the hospital over this, and I'm glad I convinced him because he ended up having a 60% blockage in his widowmaker. So, and now, luckily he went there, got taken care of. The lovely people in the hospital stented it for him, and now he's doing great.
I just kind of switched over to all pediatrics when I came here about 16 years ago. So it's fun. You know, I like seeing kids. They're entertaining. Oh, I try to get the child talking if they're old enough, because it's fun. The parents of some of my patients now, I saw them as they grew up. It's interesting. I hope I bring back the parents with their children. You know, I hope they had a positive experience, and it seems like we do have quite a few.
I get to provide services to patients starting at age 1 and through the lifespan. So I'm able to maybe see a patient in their 30s for an acute visit, and in the next room go and see a well child visit.
Getting to see patients who have been underserved, underprivileged, get the care that they need, that's the reward.
I feel like I can see the people that need seen the most without a lot of obstructions. Also just the people that I work with. I've had the same nurse for 16 years. I've had the same scribe who's also a nurse for over 10 years. So we just have a team, and we've been in place for a long time.
I love being a part of a family, and I feel like that's what First Choice is. I feel like it's exciting to see all of us come together and take care of patients the best that we can, and then you get to build that relationship with the patients. Whenever I was young, I lost my dad, and I seen the way that he was taken care of, and I just thought, if I could make one difference in somebody's life, you know, I want to be able to do that. And so that's why I became a nurse, and then First Choice took a chance on me whenever I was very young. I've been here for 10 years now, and I feel like I've gotten to do that for a lot of patients. I've gotten to help them get what they need and make a difference in their life.